If you've clicked on this video, you're probably looking for answers. Maybe you're an athlete, a parent, or even a medical professional. One of the most common questions that I get with my athletes is, when can I return to sport following my surgery? And the answer to that question isn't always clear, so let's solidify it here. So let's start with the simplest answer. The gold standard for return to sport following ACL reconstruction based off evidence in this time period is at least 9 months. Recent research has shown that for athletes who return prior to 9 months, there is a significantly higher likelihood that they may sustain a second injury. But here's the thing, 9 months is an appropriate guideline and goal, but it's not a guarantee. And certainly with medical professionals or surgeons, we shouldn't predicate our return to sport for these athletes based off solely time. I absolutely use this number with my athletes, but it doesn't tell the whole story. And there are a myriad number of other factors that play a role in why an athlete would return at 9 months or maybe even slightly earlier or 12 months. The first thing I say to my athletes is this isn't necessarily a time-directed rehab, although there is the component that we just discussed as 9 months being the gold standard. But I have them look at their rehab on more of a continuum, whether it's returning to running, whether it's returning to cutting, back to some sort of participation with their sport or full return. I want them to look at it as different phases that can be overlapping as opposed to just hitting a 9-month cut point. So as I mentioned, time is a component, and I certainly take this into account when I'm rehabbing an athlete back to sport, but there are a myriad number of other factors which would determine whether or not an athlete is appropriate to return to sport or not. So let's take a look at a few of these factors that I take into account with my athletes prior to returning to sport. So let's get the first factor out of the way, time. So as we mentioned, 9 months is the gold standard that we look at for full return to sport, or at least that bare minimum. This isn't necessarily an arbitrary number. Based off current research or past 5 to 10 years of research, we see that at 9 months leading all the way up to 2 years, this is when the graft actually starts to show signs of maturity. It starts to integrate into the joint and certainly starts to change from what we use as a tendon and turns into a ligament. That process is called ligamentization, and that takes some time. So for sure 9 months is the gold standard, but that can take up to 2 years based off research for that to integrate into the joint properly. So number two, next one we have is physical readiness. So this is what we would think as kind of the most obvious component that we see for return to sport. This is range of motion appropriate? Is there still swelling in the joint? What about strength? Hamstring strength, quad strength, hop testing, all of these metrics that we use from a physical readiness standpoint. These are important factors for sure, and obviously they should be emphasized heavily, but once again, as opposed to all these other components, this isn't the end all be all, and certainly shouldn't be a medical professional's clearance point just because someone hits these metrics. So no matter what you're doing with an athlete, no matter how strong they are, this is a very, very important component, and it should be a major emphasis throughout the rehab, but once again, it shouldn't be something that you predicate their return to sport on. What I usually tell my athletes as far as their physical readiness is just because you have a strong athlete doesn't mean you have a ready athlete. Obviously, you want a foundation of strength. In order for you to move at a very high level, you have to be strong to do it. But just because someone is strong doesn't mean they're moving appropriately or moving to the capacity that their sport requires. The next one that we have is psychological readiness. This one, in my opinion, is a little bit underestimated and often overlooked in the rehab setting, but personally, I feel like it's a crucial component to return to sport. The way I describe this to my athletes is there's two spectrums to an athlete generally that I see in my practice. One athlete who is overly cautious, a little bit tentative, apprehensive to do certain things that their sport requires. On the other side of the spectrum is someone who is a little bit too overconfident to get back, and they're pushing the rehab process. They're doing things maybe that aren't appropriate during the timeline. The way I say this is I want someone to be somewhere right in the middle. Where they're returning to sport, they feel comfortable doing it. They're returning with automatic movements. They're not necessarily thinking about the knee, but not to the point where they're almost too confident and borderline cocky to get back to sport. Both sides of the spectrums, evidence shows, can actually increase your likelihood of re-injury. So as a clinician or medical professional, you want to have a good understanding of where your athlete lies along that spectrum. Maybe if you have an apprehensive athlete or someone who's a little bit cautious to go back, maybe that's more repetition clinicians, maybe that's prolonging their rehab a little bit, or making that period of time for their return to sport spread out over a wide period where they're training, where they're getting back to, practice settings for a long period of time to build up their confidence. On the converse side of that, you have someone who's a little bit overly confident. Maybe that's holding them back a little bit more, right? So maybe that's holding them back for certain things, or, as they get back to sport, is prolonging that a little bit from those side of things, so they're not pushing themselves to get back to something that they're probably not appropriately doing correctly. Number 4, sport specificity. So what do I mean by this? The way I always describe this to my athletes is, think of the way a running back moves in football versus a gymnast, right? Or even a basketball player, or even a soccer player. The specific movements that those athletes make that are required in their sport are drastically different from one another. And if it's not appropriately rehabbed throughout the process, and the athlete looks athletic, they look strong, but they haven't actually performed movements that are required for their sport, this can be a problem. The way I describe this to my athletes is, I want your return to sport to be automatic. So when you go back to sport, we want the movements that you make to feel comfortable. We want them to feel like they were before you even injured, and we want them to feel automatic. In order to do that, you have to kind of, the way I describe this is filling in that gray area. So from a rehab side of things in the clinic, obviously we work on the basics, right? We work on strength, landing, jumping, cutting, but do we really work on the sport-specific movements? And when you return to sport with just the foundation of all those pieces, and then you go back to a high level of movement that you were previously, that's a huge amount of space between those periods, right? So between the rehab side and between the sport specific movement side. The goal for a clinician should be to integrate all of those specific movements that an athlete performs in the rehab process, so that by that time when they get back to their sport, they've already done a multitude of different movements that they feel confident to perform. This component in particular is one of the most important to me. We as medical professionals have to understand what that sport that athlete is going back to, but also what the position is that that athlete's going back to. Because we need to integrate those specific movements that that position requires for that athlete to return properly and safely. And this is where I talk a little bit about the continuum of the rehab process. We want that athlete to kind of integrate those movements back at an appropriate timeline and appropriate rehab setting throughout, as opposed to just getting to the foundation of strength, the foundation of time, and then saying you're cleared. So whether you're a running back or a lineman, those continuums throughout the process could be drastically different, even though all these other components hit correctly. So for athletes, medical professionals, here's an example of how I base this on a continuum. I'm a soccer guy, so let's talk about a soccer specific example. So if I'm rehabbing someone back to soccer, right, I may have them integrate back into a training session where they solely just do, maybe it's a warm up and a passing pattern, and then do the rest of their rehab or more some technique on the side. Maybe that happens for a couple weeks, and then I start to integrate them into more of a possession game where they play as a neutral, or they're still non-contact. So no one's actually making physical contact with them, but they're integrating along this continuum back to their sport. Maybe that goes on for another couple weeks, and now I provide them a little bit more with, let's make some contact. So whether it's that possession game or even a scrimmage, maybe they're going for 5 to 10 minutes where they're actually making contact after they've built up that confidence over the past month. This can change for every athlete. So maybe based off all these other factors, I may see an athlete ready to integrate contact a little bit faster, maybe not. Maybe that training period where they're in non-contact goes on for a little bit longer period of time. So you can kind of see where this rehab process becomes more of a continuum, as opposed to they hit 9 months, they hit 10 months, and then they're good to go. We want to see this based off of how confident and comfortable they feel. That way they get back to their sport full appropriately. Number 5, graft choice. So in the back of my mind, for every athlete that I work with, I'm constantly taking into consideration what was their surgery, right? Did they have a secondary meniscus issue? Did they have, a quad tendon graft, patellar, hamstring graft? Taking into account these anatomical considerations, the robustness of the graft, how sturdy this graft is at certain points based off evidence. You have to take these things into account based off the readiness of the athlete, because that can change. So we look at a hamstring graft where we see a little bit higher re-tear rates versus a patellar tendon graft. These things are important for the athlete to understand, but for sure the clinician to be able to appropriately rehab these athletes based off of that. I'm not going to go into detail about the specific graft choices in this video, but certainly can do that in the future if you're interested. But also we have to take into consideration this graft choice, because it does play a role in re-tear rates and re-injury rates and some of these other factors if you integrate that athlete back too early. So next one, age and level of competition. So what do I mean by this? Let's look at age first. The way I rehab a 14-year-old versus the way I rehab maybe an 18 or 19-year-old going into college, for example, is much different too. So a lot of the other factors that we take into consideration, this may be another really important one. The way I rehab a 14-year-old, and in the back of my mind thinking this person's very young, they have a lot of time, especially if they have aspirations to play in college, can we delay this a little bit with conversations of, we want to do this right so you don't do this again, versus potentially a 17-year-old who wants to get back to their final season of football, right? So you have to take into a little bit of consideration, what is their age, what's their maturity level, are they a little bit younger and a little bit more, motor control is an issue versus 17 or 18-year-old, maybe you can accelerate that a little bit. So age is important. Second thing you're looking at is their level of competition. So level of competition meaning, if an athlete is recreationally active and just wants to get back to playing, high school soccer and high school basketball, right, for example, they're not, they don't have aspirations to play in college. They just want to get back to being around their friends, being around sports in general. I would rehab that athlete slightly differently than, someone who's 17 and has a Division I scholarship, right? You have to take into account where these athletes are coming from, what their goals are as far as, what they want to aspire to with their current sport. So age, level of competition, both those things you have to take into consideration. I think going along this a little bit, and we've talked about this in past videos, even speaking with Brady Soley about this, along with like the level of competition, I also take into consideration the motor control and the neuromuscular control and how an athlete's moving, right? We've seen this before, you may have a 16-year-old who moves a little bit awkward, a little bit different versus a 16-year-old or 17-year-old who moves very mechanically sound. They have good motor control. These are other factors you want to take into account, right? So if I'm doing something high level with that maybe mechanically unsound athlete, maybe I want to guide them a little bit more. Maybe I want to block out that practice a little bit more, cue them a little bit differently, versus a high level athlete. Maybe I don't need to say anything and we can move on a little bit faster. So along with this level of competition, motor control planning and how an athlete moves neuromuscularly is also a very important component too. So when can I get back? Obviously we talked about 9 months as being like the gold standard, for maturity of the graft and beyond. Anywhere prior to that, we see significantly higher tear rates or second injuries. But also, as we mentioned, there are a number of other, factors that we want to take into account and look at as a whole, as opposed to just one cut point. Thanks for watching. If you're a physical therapist or other medical professional looking to elevate your ACL rehab practice, visit tornuniversity.com and book a one-on-one consultation where you can speak with me directly about any specific challenges you may face and fine-tune your approach to ACLs. Also be sure to check out my monthly webinar series where I dive deeper into ACL-related topics designed and shaped by your specific needs and questions. Don't forget to like, subscribe, hit that notification button for more content, interviews, and more. Follow me on social media at Torn University for more daily ACL-related topics. And as always, drop any comments or questions you may have about ACLs, and I'll catch you guys in the next video.